Hypotonia, also known as floppy baby syndrome, is a medical term that means decreased muscle tone. Imagine holding a newborn baby. Typically, a baby has a certain amount of natural resistance in their limbs. A baby with hypotonia might feel like a rag doll when held. Their arms and legs might feel loose and floppy. While it's often noticed in babies, hypotonia can also affect older children and even adults. Hypotonia itself is not a disease. It's a symptom of an underlying condition. Think of it like a fever tells you something is wrong, but it doesn't tell you what's causing it. Similarly, hypotonia is a sign that something is affecting the way the brain, nerves, and muscles communicate. The severity of hypotonia can vary. Some babies might have mild hypotonia that improves with time. Others might have more significant hypotonia that leads to developmental delays. Early recognition and diagnosis are essential for providing appropriate support and interventions. It's important to remember that hypotonia is not a reflection of a child's intelligence or potential. With the right support and care, children with hypotonia can thrive and lead fulfilling lives. Recognizing the signs of hypotonia is crucial for early intervention. In infants, hypotonia can manifest in several ways. One of the most noticeable signs is the rag doll appearance we talked about earlier. Babies with hypotonia might also have difficulty holding their head up, feeding, or reaching for toys. They might seem weaker than other babies and have a weak cry. As children grow older, hypotonia can affect their motor skills. They might have delays in crawling, walking, or sitting up. They might also have difficulty with fine motor skills, such as grasping objects or using utensils. In some cases, hypotonia can also lead to problems with speech and language development. If you notice any of these signs in your child, it's important to talk to your pediatrician. Early diagnosis and intervention are key to helping children with hypotonia reach their full potential. Remember, you know your child best. If you have any concerns, don't hesitate to seek professional advice. Hypotonia can be caused by a variety of factors. Genetic conditions, such as Down syndrome or Prader-Willi syndrome, are significant contributors to hypotonia. In Down syndrome, hypotonia is often present from birth and can affect the child's ability to develop motor skills. Prader-Willi syndrome, another genetic disorder, leads to hypotonia due to abnormalities in chromosome 15, impacting muscle tone and growth. In some cases, the exact cause of hypotonia remains unknown. This is called benign congenital hypotonia. While the unknown can be unsettling, it's important to remember that many children with benign congenital hypotonia improve over time with appropriate support. Diagnosing hypotonia involves a thorough medical history, physical examination, and often a series of tests. Doctors will assess the child's muscle tone, reflexes, and motor skills. They might also order imaging scans, genetic testing, or other specialized tests to identify the underlying cause. The diagnostic process can be complex and might involve multiple specialists. It's important to have open communication with your child's healthcare team and ask questions about any tests or procedures. Understanding the cause of your child's hypotonia is crucial for developing an effective treatment plan. While there's no one-size-fits-all cure for hypotonia, there are many ways to manage the condition and help children thrive. Treatment typically involves a multidisciplinary approach, with specialists from various fields working together to address the child's individual needs. Physical therapy is often a cornerstone of hypotonia treatment. Therapists work with children to improve muscle strength, coordination, and motor skills. Occupational therapy focuses on developing fine motor skills, such as writing, dressing, and eating. Speech therapy can help with speech and language delays, as well as feeding difficulties. Early intervention is paramount for children with hypotonia. The sooner therapy and support services begin, the better the outcomes tend to be. With the right support, children with hypotonia can overcome challenges, reach their milestones, and live full and meaningful lives.